then are the challenges. And that's what my presentation will help us, what I'm trying to do now. It's trying to be live stream, this, that, too much, Ravi. I think we should just stick to what we are doing, okay? So I am going to speak to you what I've called the evolving sanitation journey. Why is this paradigm shift? And I'm constantly emphasizing a paradigm shift because please understand, sometimes things happen with us and some things that are happening close to us, we don't realize the significance of it. But I want us to really recognize the significance of a change in the way we have decided to do what we are calling affordable, inclusive sanitation. So where are we today and where do we need to go? First, the big picture. Very clearly, there are some big issues on the table that concern us all. One, the need to ensure sanitation for all. There is no question about this. This is the world's most wicked problem. It is no question that we need to make sure that every household, every woman gets access to sanitation with dignity. But equally, and Ashokji is here with us and he will tell you, equally important is the fact that to ensure our rivers are not polluted with untreated sewage. Because that really is the huge burden of pollution on our water bodies today, is the fact that we are not treating the sewage. So we need toilets, but we need to make sure that the excreta from the toilets is also treated. And this becomes even more urgent because remember, every time we pollute any drop of water, we are degrading available water resources. We are making the task of cleaning up that water so expensive that municipalities cannot afford it, or there is a health burden. The fact that our rivers are polluted is not an aesthetic problem. It's a problem of lack of availability of drinking water, of clean water, and the cost of cleaning it. As I was telling you, when I did Excreta Matters, now almost 15 years ago, one of the things that really jumped at me is if I look at Yamuna, the city which is below Delhi is Agra. And Agra has set up a water treatment plant which is more expensive than a sewage treatment plant. Because it lives downstream of a polluted river called Yamuna. But what we need to recognize is that there is a new paradigm for managing excreta from households. And this has emerged from the cities of the South. And I say this because Ane is here, he will bear me out on this, how difficult it is to get this understanding in the wider water and sanitation forums, because this, for once, is a paradigm that has really emerged from a different part of the world. A part of the world which has reinvented its own systems because it needed affordability and only then could it be sustainable. And this did take imagination, it took courage, and that's important to recognize together. So where have we come? From 2019 to 2023. I see in this room a number of new faces, so I'm going to recap for you the journey so that you understand where we are today, because otherwise, for you to get involved with us, there'll be a group of us which will be talking about tomorrow. You need all of us to be together. So one, we have understood that affordable sanitation is crucial for sustainability. You cannot clean your rivers unless you intercept the excreta of all. So affordability in the provision of sanitation is critical. You cannot have the conventional system, and that's the second big learning which has taken a huge understanding. The conventional systems of sewage management are capital intensive and resource intensive. When I worked on Excreta Matters, I said 70% of the country's waste was untreated. Am I right, Srini? 70%. And that was 2011, 2012. Sometime at that time, we brought it out. CPCB report 2021 on the state of infrastructure of sewage management in India. It recognizes that there has been a 50% increase in sewage capacity in between 2014 to 2020. Huge investment by the government in building new STPs. But look at the bottom line of it. We have capacity of 35,000 MLD. Operational is 26,000. Utilization, which because the huge amount of capacity is unutilized because connections don't happen from households, is still 20,000. The plants that are actually compliant with the standards is only 12,000. Forget even that. The fact is, between 10 years ago and now, we are still 70% untreated. But the most important factor is this total of 70,000 MLT is from 2011 census, because we don't have a new census figure. Now, how is sewage calculated? On a per capita basis, okay? Amount of water supplied, amount of sewage generated. This figure, all Indians will recognize, is out of date, okay? We definitely have more people in India than 2011. Okay, I don't know how many, but some more, okay? So 70,000, so the gap is even bigger. Now that's the catch-up game. That's the cost. It's not the sewage treatment plant. Please don't get me wrong. There's nothing wrong with the sewage treatment plant. The technology of FSTP to sewage treatment plant is not different. The question is the method of bringing the sewage to the sewage treatment plant. Are you going to do underground storage? Are you going to do it overground? That's the big question that we have grappled with. The other learning that has been between in the last some years has been that the bulk of Indian cities, and I would wager I don't know about South Africa, Jay never shows me enough in South Africa for me to say that with complete confidence, but I can say that for most of the cities in our part of the world, I can say that our cities are still unsewered. 50 to 60% of Delhi is unsewered. Please understand, most of us live in what I call Lutayan Delhi, not most of us. Few people live in what is called, which I called Ashokji, and I call this to Hardeepji also, so I'm not saying it behind his back. I call it Lutayan Delhi, okay? In Lutayan Delhi, it is sewered, but most of Delhi is unsewered. Most cities of India are unsewered. The shit flow diagrams that we did showed us that the majority of Indians in Indian cities use what you would call on-site systems. Now, these could be well-developed systems in which, and remember, the one big learning of 2011 is that don't ever confuse a toilet with the management of excreta. A toilet is a receptacle of getting your shit, your excreta. You need to understand what is it connected to. Is it connected to an underground storage network? Is it connected to a septic tank? Is it connected to an open drain? Is it connected to an empty tank, which is then collected and taken and disposed of? That's the reality that we had in India. So the question was, and this was a tough question that we asked, can this reality become part of the future? This is real. This is India. Bulk of our cities are unsewered. Bulk of our people cannot afford, the cities cannot afford capital intensity of the sewerage system. Can we design, keeping this reality, plan for tomorrow? Or do we only have to think that this is about old India and new India will one day have underground sewerage, which, as I said, the game of catch-up never completes. So there was imagination, there was courage, and it was agreed that we can make this part of the new system. It's not small, huh? It's a huge leap of imagination that you say, my septic tank, my tank in my backyard, my terrible system that exists is not going to be discarded, but I'm going to build on it for the future. Okay? So FSTPs have been built. As I said, there's no difference between an STP and an FSTP. In fact, we are looking at co-treatment as the best way to move ahead. The question is, how does the sewage get there? Does it get there by redeveloping the full city, doing underground sewage, pumping it, connecting the household, and then taking it? Or does it get there by saying there's an existing system, I'm going to improve the existing system of transporting the sewage from the households to the treatment plant? It could be an STP, it could be an FSTP. And in this way, as I keep saying, and I was very happy that this example has captured people's imagination, I keep saying, Ashokji, that this is like the cell phone revolution in India. When I was growing up, I remember I had to go, and at that time, Jairam Ramesh was an OSD in the Planning Commission. I had to go to Jairam Ramesh and get him to sign for 4 phone lines for CSC. Okay, I had to get a favor from him to get a telephone line connection for CSC. Today, we are all on cell phones. We don't have to take anybody's favor to get a connectivity. It's the same issue. Instead of doing landline route, you went to the satellite for telephone. Why can't we leapfrog when it comes to sanitation? It's a change in paradigm by saying we're not doing the landline route, we're simply using the existing system and being nimble, being fast. And that's the fecal sludge and septage management. Now, this is the policy that I think has been a game changer. The SBM 2.0 guidelines, Chaurasia D is here. He has been very much an architect of this. Very grateful that this has happened. Has been a very intelligent policy to move beyond sewage system to the management of fecal sludge. So if you look at the policy SBM 2.0, it simply says that the cities will ensure no untreated fecal sludge or used water is discharged into the environment, and all used water, and it's an interesting term that the ministry has picked up. They're saying we will not use the word wastewater because waste is a prerogative word. We will use the word used water. Okay? Used water, including sewage, septage, grey water, black water, is safely contained, transported, and treated, along with maximum reuse of treated used water. So essentially, they are saying they are not determining whether it should be underground storage or whether it should be transported on a truck. They are simply saying, do it. Do it in any way that is affordable, convenient, and best practice for you. And as a result of this, we have seen massive practice change. Policy leads to practice. States are now building FSTPs so that excreta can be conveyed. My colleague Pavan has had the courage of putting a number on his presentation. I was quizzing him, where did you get your number from? Can I trust your number? And he's kind of saying, yes, 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 ma'am. So you will see on his presentation, he is saying 500 plus FSTPs are either being built or being built in the country. I am I have to see the number myself before I can quote it. So I just basically know a lot is happening, but I haven't seen any database that tells me exactly how much is happening, but a lot is happening. We have the principal secretary of this amazing state, and he will talk after me, because this state has done scaling. They have done a statewide transformation. And Matiji will explain to us that this state has said, we will do only FSTP non-sewage sanitation. Now that's unbelievable. And the scale and the nimbleness with which you can move. But it's happening in UP, it's happening in Tamil Nadu, Telangana, Madhya Pradesh. And what I really would like to commend is the speed at which this is happening. I am an environmentalist. I've spent all my life chasing sewage treatment plants that have not been built. And then when the sewage treatment plant gets built, you talk to the engineer and say, "अरे वो main line आनी है, वो main line अभी connect नहीं हुई है, अभी 3 किलोमीटर बचा है, 2 किलोमीटर बचा है, अभी 5 households अभी और connect होने." I have kept those maths for years and years and years. And I've always wondered, when will we clean our rivers if those are the maths we have to follow? But the speed and the scale of this transformation excites me because you can do this faster. You've built on what exists. You haven't recreated it. You've actually built on what is the reality. If you look at Uttar Pradesh, 62 new plants, and many of them are coming with Ashokji's institution is working on them. And a lot of them are coming with co-treatment. Because why also redo if the plant already exists, sewage treatment plant already exists, why would you go and make a new plant? In a country like India, we must be very careful about the cost. We should maximize public expenditure. So there is no ideology here. We should essentially go back to what the SBM 2.0 guidelines have said: treat it, clean it, reuse it. Do it any way you want. If you look at this, and my colleagues will talk about it, in UP now, we have done various reports to understand what is happening and what needs to be done further. But I want to focus on this because this is the agenda. I hope I have helped some of you to catch up to where we are and my excitement with why we are all here. But this is the agenda for this conference now, because we have come somewhere, but we have a long way to go. And I want to lay out some of the agenda points that I think this 2 days, 3 days has to put their heads together to really understand how do we move ahead. The hard work begins now. One, the plants must work at capacity. We cannot have another issue like STPs, ki plant ban gaya, magar sewage nahi hai. We must make sure the FSTPs are run to capacity, which also will affect the performance of the FSTP if it is not run to capacity. The question here is, what is the best business operation model so that the cost for desludging is affordable? The operator has an enforcement mechanism to bring the sludge to the plant, and the economics of the plant also work. So that's the economic model that we must be discussing. There are some very interesting work happening in Tamil Nadu, which is different. Odisha has a different model. UP has a different model. We need to put our heads together to see which is the model. And maybe there is no one model. We need a menu of models, but we need to understand what is the cost of desludging, what is the cost which will make sure that the plant is sustainable. Second, what should be the FSTP, the treatment technology? Should we standardize it or provide guidance? The best thing with today is that we are getting enormous innovation and experimentation in the technologies. But as government will tell you, they need some standard protocols, guidance. They also need technology guidance with cost. Because one of the big issues that we are finding is many of the plants are over-designed. And because they're over-designed, the cost is higher. And if the cost is higher, it becomes also more costly to run in the future. So what can we learn from this is something that we need to work on. Third challenge, that the treated water must be reused. The plants have to be designed for that. How do we do that? Fourth, and this is the big one, is that the sludge, because remember, we dewater in these plants. What should happen to the sludge? Do we need new standards for biosolids? And the fifth is, for us, the most important part of what we are doing is that it has to be inclusive and it has to be sustainable. The poor in the city must get access to sanitation and the river must be cleaned, if I can put it as bluntly as that. Okay, those are the two tasks in front of us. How do we create a methodology for tracking outcomes of both? That we don't go offline on inclusivity, we make it so expensive that the poor can't afford it, or that in spite of all putting up all these plants, our rivers are equally contaminated. Both are our challenges which require us to track, And we need methodologies to track both issues and keep doing that to know that we are on track. My colleagues have done these reports, which you will see and talk about. They basically help us to understand the operation and maintenance costs. They help us to understand the technology choices. The technologies that have been used in UP, this is UP, essentially tell us that there is a menu of technologies. The cost also is then the operation and maintenance cost also goes because the electricity is the key factor in all this. Maintenance cost, there are only two major costs of running an FSTP. The electricity costs and the maintenance cost. Land cost has to be then compared with, if you have a compact area, then you need a FSTP, which is designed for compactness. If you have large land, then you design it for treating the waste using other principles. So I think what we need today is to understand these technologies that are emerging and what it is. My colleagues, and they will present this, have done a report on FSTPs and STP co-treatment, 69 treatment plants in 8 states. And the bottom line, there's a lot of, the bottom line and the good news is that the technology is not a challenge. The problem is operations in the plant. You can choose any technology. It is capable. All plants have met the BOD standards. And you're talking about sludge coming at, 8,000, 10,000 mg per liter in terms of BOD. And yet the plants do meet the treated water effluent standards. But we need to make sure that there is a good standard operating procedure in the plant so that the treated water can be reused. The big thing that I think needs to be discussed, and I want to flag this, is the question of biosolids, the sludge. Because remember, the FSTPs have been designed for liquid-solid separation. So the liquid is treated, the biosolid, which is the sludge, is dried and then stored. How do you use this? And we have done an analysis of 47 FSTP, 14 STP sludge. It essentially is a very nitrogen-rich sludge, understandable. It's human excreta. It's heavy on nitrogen. It's low on carbon. If you mixed it with vegetation, with leaves, wet waste, it'll meet your CNN ratio. No problem, okay? Problem is that we don't have standards designed for this kind of sludge. We have compost standards. So, and the fact is, we need much better operation for pathogen management. When my colleagues did this report, my big question to them was, any technology which is incapable of dealing with pathogens? And they said, no. The same DWATS plant has pathogen management as another DWATS plant does not have pathogens or has pathogens in its sludge. And the problem was, and it's a simple problem, there wasn't enough time for drying the sludge. So I also would urge you that we need to look for solutions for all this so that they are simple and easy for operators to manage. Lastly, the big challenge that is now on our doorstep is climate change. Extreme rain and rising heat. We know that extreme rain events are linked to climate change. We will get more rain in fewer number of rainy days, and this leads to urban flooding. Combine this with temperature increases, it will increase the demand for water, evapotranspiration, and in turn add to water stress. Today, it does not rain, it pours. Most cities in our region are seeing that their rain comes, their entire year's rain comes in a matter of a few hours. That leads to huge flooding and a problem of scarcity post. And the agenda, therefore, is for us to augment supply, make sure that water demand is as efficient as it can be, not just in agriculture, but also in cities, which means reducing the length of pipelines, reducing water wastage in our distribution system, and the management of pollution. And this is really what I'm going back to a report, 2004, we did this report called Dying Wisdom. We showed how every region of India had its own system of water management, but it was designed on one simple principle: catch water where it falls. Rain is decentralized, so can be the supply of water. And look at the gains that you get between that agenda that we're talking about and the new agenda. If you invest in water bodies, the sponges of our cities, you recharge groundwater, the challenge that the minister talked about. If you make sure that every drop of sewage is treated and it does not contaminate the groundwater, our water bodies, you actually end up with creating a system in which that water is clean and reusable. So you need to link water recharge systems to treated water reuse. So the STP, FSTP, treated water that comes out has to go into the sponges of our cities that we are creating so that it can recharge the groundwater system. That then makes the city more dependent on its groundwater, and that improves its water security rather than conveying water from long distances. So what we need to do is to join the two agendas of water, sewage in climate risk times, because at the end of it, we all live downstream. Your waste is my water. That's Agra. This is Delhi. Okay, 22-kilometer stretch of Delhi over the course of the Yamuna. 21 nalas that flow into it, okay? It makes sure that that red spot, 22 kilometers only, leaves the water so contaminated that Agra has to build a sewage treatment plant instead of a water treatment plant, okay? But your waste is my water, and so my waste should become my water. That has to be our slogan. Thank you very much. Ashokji, if I can invite you and Matiji to the stage now. I'm sorry I made you sit on this table, but I thought it'd be much more convenient for you to hear this. Please start. I would like to. So I will first invite Mr. Mativatnan, who is the Principal Secretary, Housing and Urban Development, Government of Odisha. I've already given a sort of a quick thing about why we are so excited to have you here. But Mati, your presentation.
Not responding. That's the one. Yeah. It's just not loading, sir. Sir, you can just. Yeah, it's done.
Thank you, Ji. Good morning to all of you. Thank you, Sunita Ji, for giving me this opportunity, inviting me, and also for giving us a very enlightening presentation. You are not drizzling, you are pouring. For all the 4 days, whatever could be, she has done it in 15 minutes. I would be talking about Odisha's transformative journey in water and wastewater management. Water I have included. So we can't talk of sanitation without water. So giving a brief overview of Odisha, we have 115 cities, 5 large corporations, 48 municipalities and 62 small towns, 70 lakh people living in the 115 urban local bodies. Out of that, roughly about 17-18 lakh people live in the slums. Roughly about 25% of the population live in the slums. When I say 2,919 slums are there with 17.83 lakh population, I say after an enumeration process. If you ask any other city, how many slums are there? How many families are there? What is the population? Not many cities will be able to tell that because enumeration is not being done. Not much intervention is not being taken up. Governance is relatively less in the slum areas, and they are our problem areas. When we talk of inclusive water and sanitation, they are the catchment areas. The first is the Odisha's journey in the water supply. The challenges we faced in 2016 when we started the journey would be similar to any other city, any other state, or any other developing country would be having. Less than 40% of the urban areas were networked, less than 30% having house connections, low pressure, erratic, intermittent supply. People were largely dependent on hand pumps and the tanker and the syntax tanks positioned. Timings, Sunita ji was asking, she wanted to find out from the people where the water comes from, where the shit goes. People will say water comes from the tap or the tanker or whatever. The shit goes to the toilet. This is what we know. And when we talk about water, we will say that water God gives. Water is so precious, God gives. So God only knows from where it comes. And when it will come. God only will know when it will come and how much it will come. So that kind of erratic supply, uncertainty, intermittent, all. Disparity within the city. Bhubaneswar being the capital, the most powerful live there. So Bhubaneswar gets sufficient water, and the far off western Odisha, southern Odisha would get meager water. Disparity between the cities and within the city also. The slums may not be having the pipe network, they may not be getting the water, and posh areas get more water, less influential area get least water or no water. Overall state water supply deficit was about 157 MLD. There was absolutely no metering. Metering concept was not known in 2016, and hence very low revenue collection. Water loss was to the tune of 50 to 60%. Under Amrut 1.0, we have done the water auditing in 9 Amrut cities, and the water loss was about 50 to 60%. That would have been the scenario in all other cities. And there was absolutely no consumer connect or community connect. So the vision we had, the trigger was, thanks to Government of India, Amrut mission. The trigger was Amrut mission, that we started executing the Amrut pipe water supply projects in 9 Amrut cities on universal coverage basis. That gave us the insight that if you do it in 9, who will do it in the rest of 105 cities? Who will take care of that? Just because 9 cities have more than 1 lakh population, you can't deprive other 105 cities which have less than 1 lakh population. You are not taking care of them for water. So we said that the entire state, all universal coverage, leaving no one behind, no city behind. We should do this transformative. So vision of change we had in 2016 was that 100% houses in all urban areas, in all cities, should have adequate quality and quantity of water. That was the vision. Where are we now? We started the journey in 2016, 17 we moved. Now 107 out of 115 cities have 100% pipe network. We started with the 40%, less than 40% network. The house connections, that's the last mile connectivity. That's the ultimate objective. We started with the 3 lakh in 2016. Now we have 9.97 lakh house connections. 96% of the households, families have piped water connection. 105 out of 115 cities have 100% house connections. When I say 100% house connection, it is not 99.9%. It is 100% universal coverage, SDG goal, leaving no one behind. These 105 cities, including Bhubaneswar, Cuttack, Rourkela, Sambalpur, Berhampur, all major cities, you cannot find a house in the entire city. That's a challenge we give to everyone. You go to any city, find out a house which does not have a tap water supply connection. You cannot, because the cities have declared, and there is a strong protocol for declaring it. Somebody was asking us, how do you say that the entire city is house connected? 100%. What is the proof? Community verifies. There is a multi-member committee to verify in the field. We proclaim in the newspaper, inviting objection, suggestion. Then it is timeline is given. There is a stringent protocol to follow that. Then the PHO tweet it, the district collector tweet it, the mayor of the city tweet, the engineer in chief tweet that this city has achieved 100%. It's a public declaration. Anybody who has not got in that city can contest it. Because we have so many medias and so many political parties. It's not so easy to declare something and you go scot-free. So 105 cities have achieved. Remaining 10 cities will achieve by December 23. Moving to a higher orbit, we took up drink from tap mission in 2019. When we crossed the 90%, then we thought that we should focus on the quality, because I'm happy that I'm able to drink this. Yeah. But most of the meetings, we drink only bottled water. In our own meetings, we used to drink bottled water. And when I asked my engineer in chief about the quality of water, he said that we are giving good quality water. I said, if you are giving good quality water, why are you drinking the bottled water? So he was hesitant. How many of you are drinking water from the tap in your home? None of us. Neither me nor any one of them. We treat the water. We supply the water. We don't have the confidence. We can't drink. How can we ask the public to drink? Right? And water supply is known for waterborne diseases, diarrhea, all these things. So we thought that when we talk of giving good quality water, it has to adhere to some standards. It can't be relative. You can't say that it's good and you can ask people to drink. So then, following the IS 10,500 quality standards, then notified it, then we followed, then we took up a mission called 24/7 drink from tap. Directly drinkable water from the tap. That's the mission. That water has to be mineral water adhering to IS 10,500. You would be happy to know that Puri has become the first city in the country, entire country, to provide pan city at the entire city level, 100% house connections, all to provide mineral water conforming to IS 10,500 in July 2021 July, followed by Gopalpur last year. Now 21 cities have partially, including Bhubaneswar. 30% of Bhubaneswar is now drinking from tap. So about 8 lakh population in Odisha is now drinking more, which is more than 15%. And we have a target of achieving in all the 21 cities by December 2023. That's the target given by our Honorable Chief Minister. So we are hoping to achieve that. So not only that, Bhubaneswar has become the In fact, in October 2020, we wanted to declare Bhubaneswar as the first city which has achieved 100% house connection. So we checked up with the ministry, we checked up with CPHO, we checked up with everybody that. So is there any other city which has achieved, or we can take pride that, because it's a sign of inclusivity. Not that I have achieved 100%. I've ensured that whoever lives in the city has an access to tap water supply. That's a pride moment. So we wanted to declare it. So we checked up with various sources. Nobody has any information about it. There is no data available. That's the sad part. So then we were also slightly, then what we said that we made it conditional. The first million plus city to achieve 100% house connection. I was sure that no million plus city would have achieved it. So we have tremendous trust on our system. Then somebody was asking, how do you declare it? Is there any evidence? Then I don't have any evidence. Let somebody come up and say that, no, you are not first, we are first. Then I will withdraw it. I seek a public apology. So till today, nobody has approached us. After that, 105 cities we have declared. Till today, nobody has contested it. We keep on doing it. So in October 2020, we declared that. And today, later on, I removed the million, because once I got to know that there is no claimant, we said first city, second city, third city. Now it is 105 cities. March 2023, we achieved 100% metering of Bhubaneswar. The largest. It's not that we have done in a small town. Largest with the 12 lakh population. Not only 100% house connection, 100% metered house connection. So we started with, as I said, there was no metering in the entire state. We started with 0 in 2019. We took up the metering because that metering is a sustainability. So now we have achieved more than 3.75 lakh metering, and starting with the Bhubaneswar, Puri is already 100%. Wherever we are implementing 24/7 drink from tap, it comes with 100% connection, 100% metering. So it's part of the drink from tap because without meter, you can't provide 24/7 supply. Then it would be 24/7 consumption. Then you would be encouraging people for irresponsible consumption. So it comes with that. So all cities will have by December 2024. Now the state is 100%, 40% metered from 0. So as I said that we moved to a higher orbit, 24/7 water supply, conforming to IS 10,500 quality standards, 100% meter connections. Interestingly, the NRW has come down to 15%. Wherever we are implementing 24/7 drink from tap, the NRW is less than 15%. In some cities, less than 10%. You will be happy to know. Otherwise, 24/7 will not be sustainable. So people will ask whether your 24/7 will be sustainable. It would be sustainable because the 24/7 is 100% metered. 24/7 is 100% revenue collected, and 24/7 gives the advantage of reducing your NRW from 50% to 15%. You don't need to increase the tariff at all. If you do the system improvement, it would make the system sustainable. We are an example for it. And we have adopted smart water management because we need the technology because when I say that conforming to IS 10,500 mineral water at the consumer taps, it's not an easy thing. When I ask you to drink from tap, it's not easy to. And who underwrites this? Who underwrites for the quality? The Honorable Chief Minister of Odisha underwrites for the quality. We put his photograph and say drink from tap conveniently so that I can't be hanged. And you would be happy to know that the first glass of water he drank the first glass of water. And he's 76. We had the guts, we had the courage to ask him to drink from tap. That's the conviction our team has, that it adheres to the quality standards. It is pure. And we have taken up a campaign because when I say it is pure, will you drink? You will not. Because I have a legacy. Public water supply system has a legacy. Legacy of supplying erratic, contaminated water. So people go to a shop, buy water and drink. They won't even see the brand. You don't need to have a brand in the bottled water or even in a pouch. People have tremendous trust on private water. But when it comes to government water, they will not have the trust because of the legacy problem. So that's the reason that it's not only important that you provide clean water, it's also important that you work on the trust, improving the trust of the people, create confidence, public trust and confidence, so that they shun the bottles and start drinking your water. So that campaign, Pure for Sure, again with this chief minister's photograph, he is the most saleable person in the state. So with his photograph, he can only instill confidence. So with his photograph, we say Pure for Sure, drink from tap. And you will be happy to know the NIU has done a study in Puri, impact study of Puri drink from tap. 88% of people now consume directly from tap, which started from zero. That's the confidence. We are hopeful that soon you would be happy. We would be happy only when 100% people drink. But we are not able to penetrate into the star hotels in Puri. Puri is a pilgrim town. We are not able to penetrate. They say because the people are tourists. So hoteliers say that, sir, it would be very difficult to convince them because they come from various cities. So city water they don't trust. And you will be happy to know that Puri revenue collection is 97%. When I said that quality, we underwrite for the quality. We do the smart water management, and we have also deployed industrial IoT in the entire pipe network. Every 200 meters, we know the quality parameters. The water critical parameters, we know, we monitor. So how did we do this? Some of water supply is not just what we have achieved is not just a technical solution. It's not an engineering solution. Lots of policy measures have gone into it. And lots of social engineering process has gone into it. Community partnership is the foundation on which we have done the transformation. Without community partnership, this transformation will not stand. So what we have done is that we have adopted the technology, the latest modern smart water management, including that, and we have also brought the community. We have stitched that partnership. It stands on the community strength. So we have introduced a concept called Jalsati from the women's self-help group. So they are our brigades in the field. Engineers only execute the project. Below that, starting from water supply connection to managing the connection to the meter reading, billing, collection, everything, the grievance redressal, everything is the responsibility of the Jalsatis. So as a matter of policy, we said that people have a right to tap water. In 2016-17, we took that policy, right to tap water. So when I said right to tap water, we said no to hand pump tube well. Earlier, we used to sanction 500, 600, every MLA will come and ask for 500 hand pump tube well. Every summer, they will ask for it. Every minister, MLA, MP. That was the only political request. So 2016, we said that you have a right to tap water. You ask for over a tank, we will give you. You ask for pipe network, we will give you. We will not give you hand pump tube well because it's not a rural area. Tap water, the pipe water, the hand pump tube well is a rural character. You are living in a city. Don't lower the status of your city. That is how we educated actually the political leaders. Now you know the same MLAs and MPs, ministers who are seeking hand pump tube well in 2016-17. Now they are coming and asking, sir, when will you give me drink from tap? We have elevated them. They have grown up. It says that now it has become a catchy thing for them, fancy thing. Every city should have. It's something like metro rail. Like every city will aspire for a metro rail. How small it is. So now they are asking for drink from tap. We'll say that you have a right to drink from tap. We'll give you. It's now we are constrained by our capacity to expand, scale up. From Puri, we scaled up to 21. Now we have to move to, but all 21 are large cities. Relaxing the house connection norms for the poor, no upfront fee, no sanction fee, all those things to enhance the connection. No need of property ownership, lease deed and all, but documentation. Professor Chari has done a the study on the number of documents required for getting a connection when you apply for a house connection. There are states which seek 36 documents. Odisha was not, and those, amongst those 36 documents, IT return was one. And for say many, there were many documents, nobody would know why those documents were asked. Maybe some states would have asked for the death certificate also. So Odisha was asking for 14 documents. So we scrapped all those things and reduced it to 2, your ID proof, Aadhaar card. And second is the indemnity undertaking, saying that whatever land dispute, whatever dispute would be, it would be, the PHO would be indemnified from it. That's the undertaking. Only 2 documents now required. Take your connection, 7 days time. So easy installment, connection fee, all those things eased up. Composite administrative. Earlier, we implemented about 1,000 projects. Normally, the government system, every project gets administrative approval, technical sanction, and it's a file movement. From the lowermost clerk to the minister, the file will move. Several hands, several tables, several months it will take to finally get the sanction. In one lot, we gave approval for 555 projects in one file, in one letter. The composite administrative problem. So then house connection. When house connection, we never bother about house connection because house connection is the consumer's responsibility. In most of the states, it's the consumer's responsibility. Laying the street line is public work. After that, you apply for connection and then you get NOC from the municipality for road cutting because you have to cut the road and then do the connection. Road cutting permission has to be obtained from municipality. You have to pay road restoration, cutting and restoration charges to municipality. Not less than 10 to 15,000 rupees you have to pay. And for that, the municipal engineer will have to make an estimate. Road cutting and road restoration estimate. Based on the estimate, then he will tell you how much to pay. Then you pay that amount to municipality, get a permission. Then, since it's consumer responsibility, you engage a plumber, contractor. Then you make the connection under the supervision of PHO. This is the process, most of the states. That's the reason that even after laying the pipe network, completing the project, house connections will not be happening because of the documents requirement, bureaucratic process, and these hassles. It's not easy process to get house connection. And you have to run after the offices. So what we have done is that we simply said that house connection is the public work. Simple. You don't have to go to municipal office. You don't have to pay 15,000 rupees. You don't have to engage a contractor. You don't engage to execute the work. It is our responsibility. We charge you 3,000 rupees nominal. Yes. Yes. I'll come to your subject. This is my subject. Yeah. So that's what that. So all these things, then community partnership. We reached that. Absence of community connect, I said. Jalsatis, Honorable Chief Minister, speaking to the Jalsatis and handing over that responsibilities. And this is the transformative path we followed. We took it up on a mission mode approach, mobilized funds through convergence, including Government of India, state government, CSR, MLA-led, MP-led, all funds, focused on infrastructure, enabling policy measures, and capacity building. When we took up 1,000 projects, it's not so easy to, because we were executing projects worth 100 crore every year. We wanted to take up 500 crore, 600 crore. How do you scale up suddenly? You don't get so many. Who will prepare your DPR? Who will execute your work? So large scale capacity building of your own engineers and your own contractors. So how do you relax the eligibility norms? Because they act as a kind of, it's very fortified. Every department is fortified. They don't allow contractors from other. Lots of administrative reforms have been done. Then we moved to drink from tap. Now it's 100% house connection, 100% metering, non-revenue water reduction, all those things. We are now moving to higher orbit. In this process, we also experienced certain myths have been broken. We didn't break it. We didn't know. But after executing that, we realized that all these myths have been broken by us. Number one is that if you provide 24/7 water supply, it is unsustainable because people will consume 24/7. You will not be able to meet the demand, it would collapse. You will come back to intermittent supply. That's not an, initially people are very, excited about getting water all the time. They'll consume for 1 or 2 weeks, they will consume. Once they know that the water is available all the time, then it drops. In many cities, actually the consumption has slightly dropped because they don't need to store water, and next day when water comes, they don't need to waste it and store afresh. That's what we do. So that certainty, all the time availability will ensure that the consumption is appropriate. And increased wastage, all those things, high operation maintenance cost, no. Huge manpower required, we have not increased our engineer strength by even one. We have not recruited anybody. What we have done is that we have engaged 950 Jalsatis. From the self-help group, it's performance linked incentive basis. Whatever performance they make, whatever revenue collection they make, the 5% they get for every activity they get. And now wherever we are implementing the drink from tap, unauthorized connection is 0. There are no illegal connection because the community, the Jalsatis make sure that there are no illegal connection because they get commission for that. For converting every unauthorized connection to authorized connection, they get 200 rupees. Revenue collection, for every revenue collection, they get 5%. So they have an inherent interest, economic interest to ensure that there are no illegal connection and the revenue collection is maximum. High capex, you don't need high-end external experts. We don't have any experts from abroad, and we have not availed any loan. Generally, 24/7 water supply, they say that you have to have external funding. Look for World Bank, JICA, ADB funding. You don't need because they don't cost much. So these are some of the myths broken coming to our agenda of non-sewered. When you supply drink from tap 24/7, how do you manage it? The challenges which we encountered in 2000, this is the first journey we started, by the way. Before water, we started the FSM way back in 2015-16, thanks to BMGF. BMGF partnered with us from 2014-15 onwards. So you have set the context, challenges, why we went for non-sewered, decentralized, DWAT system. I don't need, she has already explained all those things. She has set the context. But one thing I can say that we have hard experience of implementing an underground sewerage system in 5 cities. Bhubaneswar, Cuttack, Sambalpur, Rourkela, Puri. 5 cities we have implemented underground sewerage system. And we have the first-hand experience of executing a underground sewer system. You might have heard that it is very difficult, very complex. It's one of the most complex civil engineering project, I would say, maybe next to underground tunnel, metro tunnel kind of thing. It's such a difficult. That's the reason Cuttack started in 2013, not yet fully completed. Still not done. We could do so many transformations in so many areas, but not in sewer system. Sewer system is beyond us. Extremely difficult because of the gravity flow, because of the gradient we need to maintain and associated issues is extremely difficult. And retrofitting a city is not an easy job. You are not creating a green field. Retrofitting, it's like doing a bypass surgery when you are alive. So that it's so difficult. It's so painful because we have experienced the public inconvenience and the opposition from it, because there are no one in favor of that, because sanitation is no one's agenda actually. That kind of concern, awareness we don't have, unfortunately. When you talk of sanitation, you only are trying to promote. They are not receiving it. And there are no takers for underground sewer system, for your information. People hate it because you cut open the road and keep it open for months together, years together. You don't close it, you don't complete the project because it's so complex. And I remember I received a letter from somebody saying that, sir, my daughter's marriage is in December. Will you complete sewer project before that? Because he has to decide the venue of the marriage. Yes. How crazy is this? That means I am deciding the marriage of so many people. Yes. By that, I should have written that I don't know whether this will be completed before your grandchild's marriage. Forget about your daughter's marriage. It's so painful for everybody, administrators, police, traffic, school children, so much inconvenience, not so easy, especially in our cities, small cities, medium-sized cities, with congested roads, narrow lanes. How will you relate? You are completely, halting their life. Their life is affected for years together. That's very unfair. You can't do that. Just because you don't know an alternative method, you can't penalize them. That was the scenario. I used to say that the pain is, you can compare the pain with the labor pain. That's the kind of pain the administrators, the executants will undergo. Only thing, the labor pain, ends up with the happiness. Here it doesn't deliver anything. So where are we now? The journey which started in 2016, 15-16. 2018, we organized the first national conference on FSM in Bhubaneswar in October 2018. Honorable Chief Minister inaugurated the conference and also inaugurated 6 plants. First 6 plants in the country were inaugurated in Odisha. And today we have 111 FSTPs functional in 109 cities in the last 6 years. And out of 111 plants, 100 plants are run by women self-help group and transgender groups. The FSTP is run only by the community partners. It's not run by this model is made for them actually. So they only run it, and the remaining are still with the contractor's responsibility, the construction agency's responsibility. Once that responsibility is over, defect liability period and operating period is over, then it would be handed over to our women self-help group or transgender group. Out of 111 FSTPs, 7 FSTPs are run by our transgender groups, including the largest in the state, which is Bhubaneswar, 75,000 liters. And one of the Cuttack water treatment plant is run by transgender group. When we talk of inclusivity in water and sanitation, we are moving towards that. They are involved in the entire value chain. And not only that, we are saturating the requirement of the cities, we also create a surplus capacity for the cities, which is being availed by the rural areas. Now we have moved to, I said that 100th plant, we signed the partnership with the women self-help group in a place called Polasara, Ganjam district last week. This is how we celebrated that 100th FSTP handing over. So most of our FSTP plants are sanitation parks, or all FSTPs are sanitation parks. All FSTPs are energy parks, solar energy parks. They generate solar energy and net metering. All our plants are produce surplus solar energy, and all FSTPs are provided with street furniture, lighting, children play module. They are all public parks, and the communities come to that morning, evening, walking tracks are there. And many people actually may not know that it is a FSTP and the fecal matter is being treated there. They think that it is a park. And that is how we have, over a period of time, developed these FSTPs. And when we talk of inclusivity, when we talk of wastewater management, sanitation, we cannot forget our sanitation workers. The core sanitation workers, the manual scavengers. I may be filing affidavit in the Supreme Court that manual scavenging does not exist, but does not mean that manual scavengers don't exist. They still exist, and they still die in the sewer pipe network and septic tanks. They continue to die. So we recognize, Odisha is a state which recognizes that manual scavengers do exist in the system. How do you solve a problem? If you continue to deny it, you can never solve a problem. So Odisha is the state which said in 2020 September, that yes, manual scavenging exists, though it is banned by act. So we came up with an act, Garima, which means in Odia, dignity, to provide safety, dignity, and the welfare of manual scavengers. We came up with a scheme, and you would be shocked to know that in the entire country, I can give another challenge. In the entire country, scavenging is not listed in the list of labor activities. The wage order, which specifies how much wage the worker will get for the highly skilled, skilled, low skilled, and unskilled, does not include scavenging. That was a revolution. That was they were so marginalized that this activity, though we avail it, we don't even list it. So they are all they all get as unskilled worker because it is unlisted. So we modified it and then we made that, we said that they are the highly skilled. It requires high skill to get into a sewer network system and clean it. And we are yet to come up with appropriate machines for that, devices. It's a highly skilled till we do that. So the wage has been increased 50%. And they are now categorized as highly skilled worker. And we have also introduced something called risk and hazardous allowance, like the mining activity. Somebody is getting into the sewer and the septic tank doesn't know whether he'll come out or not. Is there no hazardous in this? There is no risk in this. So we introduced that for the first time. 20% of the daily wage is given as risk and hazardous allowance for the core sanitation workers, plus all other safety devices, equipments, all those things have been provided. Now, I can say that it is extremely difficult to die in the sewer system in our sewer network. It is extremely difficult. We made the system so robust that it is extremely difficult to die. So these are some of the mechanizations. Small cesspool vehicle to access the inaccessible narrow lanes. Slums, your cesspool vehicle cannot go. What will you do? 40% of Bhubaneswar live in the slums. 40% population. 33% of the Cuttack population live in the slums. That means your cesspool will not be negotiating those lanes. So we came up with a 500-liter small vehicle, 3-wheeler vehicle, cesspool vehicle to deal with that, and a large hose with booster pumps to access long distance. These are the local innovations we have done. We have moved to rural areas also. The capacity which we have created, the FSTP which created, the system which we have developed, now we are extending that facility to the rural areas, onboarding the panchayats and the blocks providing services. UNICEF and CPR, BMGF, they are our partners in this. And we also have our online service delivery platform we have developed with the help of eGov. Next is when we talk of black water management, we cannot ignore gray water management. So it has to come in, it has to be together. When we talk of sanitation, we should talk of water. When we talk of black water, we need to talk of the gray water. And our friend Chaurashi ji is here. He is part of our gray water management team. He is an advisor. So he visited and then seen the work on how we are handling. Now we piloted the gray water management in 2 cities. We took up this in 2021 and more than 1 year old, 2 cities, Jatni and Denkanal, we have completed the pilot, successfully completed the pilot, developed the scalable template and presented before the NGT also. And Government of India's, the advisory committee also visited the field. And then it is also, they have given their suggestion also. Now we are scaling up in the entire state. And it's a 4 stages management process, starting from household, the street level, lane level, community level, and at the city level. We try to maximize the impounding, retaining the water at the managing the water at the household level. Whatever is not possible at the street lane level, then whatever is the spillover is at the community, and ultimately whatever could not be handled at the city level with the stabilization and maturation pond system. And that's big now started. We have a target of completing these by December 24. So with community partnership, our water and sanitation journey continues. Thank you so much.
Thank you. Brilliant. I think it's amazing to see the scale of transformation. I think that's what is Wonderful. Let me now invite Ashok Ji. G. Ashok Kumar is the Director General of the National Mission for Clean Ganga. As you know, one of the biggest missions of the government, and a very tough task, but something that Ashok Ji has a lot of passion and commitment for this issue. So, you know, he's not just the head of the mission, but he really believes in many of the issues that we are working on. So Ashok Ji, please, floor is yours.
Good afternoon, everybody. After a marathon session of almost an hour by Martin, I hope that you will give me some time, because generally the conference pattern used to be like, 5 minutes you push say and go. So I also had come for that 5 minutes bullet. So, but now that I don't know whether it's a special privilege given to Mathivan or whether I also have the privilege of talking for an hour. Don't worry about that. As Sundaji said, I'm very passionate about water. It started long back from the year 2000, 20 years back, where I was a DM of a place. Because normally IS officers have the habit of speaking while I was a DM and all, but then this is something which is very unique. 2000, we started 1.4 lakh toilets. Can you believe 2001, 1.1 lakh 40,000 toilets we built, Pakka toilets in Nizamabad. And also we had something called the drinking water habitation committees formed in 2001, when water was never a priority for any collectors. In fact, I had a secretary from Government of India who actually chided me for doing this thing, because I mixed a couple of the schemes and I made a potpourri of schemes to do that. So we had a scheme from the Government of India called, for managing this treatment, making toilets, about 375 rupees in 2001. That was the money available for making toilets. I don't know how can anybody make toilet for 375 rupees. So 375 rupees was from the Government of India, and at that time our CM was Chandrababu Naidu. I'm from Andhra Kada, Telangana Kada, erstwhile Andhra Kada. So we had CM also putting in some money. And then there was this scheme for Food for Work program. I don't know, many people who are aware of it. So that Food for Work program was actually meant for making roads and all. So I had tried to, as a collector, try to put all these together, and about 3,500 rupees, we started making toilets. And it's a total people's participation. I started off with school children. 1,000 schools we had toilets, 3-4 toilets in each of the schools in 2001, and given to the girl child, because normally you see in all the schools, the toilets will be built, beautifully kept, and the keys will be with the headmaster. And that will be only open when the DEO comes in. That's the way our toilets used to function. Anyway, so we made a committee of 5 girl child, and they maintained it. And they were the brand ambassadors or the big pushers in the home when we started this 1,40,000 toilets in a matter of 1 year. 1 year we completed 1 lakh toilets, and 1 year, 3 months, because so much of pressure was there, we completed it in 1,40,000 program. And all their names have been registered at that time. Again, you please look at the time frame. I don't know, youngsters may not believe it. This is when the Excel and all were just coming in. So I had a Excel sheet with all the names and given to, for public for verification, still available. So this transparency and the making payment regularly to the people, and the work was not done by the contractor. It is done by the households. So what happened in that transformation? We had a very interesting social transformation, because Government of India and the government programs used to be given only for poor and backward caste people and the below poverty line people. So we had a situation in Nizamabad where poor people had toilets and rich people did not have toilets. So that is a very interesting aspect. And then some of these young students stood with Lati outside and said, if any of these the big house people go out, I'll beat them. The Lotaband character they had with the Lati, and telling that if anybody of you comes out, you are spoiling our water. No, look at that social transformation. And And then we also had this habitation-wide drinking committees, again in 2001. So these two, and there were 5 women who were handling these habitation committees, and their job was only to ensure that the water tank from which they get water is clean. So I didn't want to get into a fight with the sarpanchas who were willing to spend money. And if you have if you enter their financial domain, there always fights happens. So I said, only your job is to ensure that the water state of cleaning of the tank, you write there, and on that day it has to be clean. And I told the women, you please don't check up how much money I spent. That is this problem. Let the Panchayat Raj department take care of it. You ensure that the water tank is cleaned. And these two things, what the effect of it was, very proud. My diarrhea cases came down from 5,000 odd to 157 in 1 year. And that is a major, major breakthrough. And that's, again, association with water continues. So second was in Hyderabad. Anybody from Hyderabad here? Asha, okay. You remember 2008, we had the, 2004, we had the daily water supply. Sorry, 2008, we had the daily water supply started scheme. Hyderabad used to get water once in 3 days, tap water. So he was talking, Mathian was talking about 100% water supply. Hyderabad, for the first time after 83, got 100%, daily water supply once in 2008. And we had association with water like that, bringing in Godavari water, etc., etc., etc. So when he came to Delhi, I'm just telling most of the issues of water and water-related issues, we had sort of had an experience, and I can also talk to Sinta about the many challenges which she had flagged, and many of them were sort of addressed. So one of the campaign in 2020 we started was the Catch the Rain campaign. So we had a campaign called Catch the Rain with the tagline, Catch the Rain, where it falls, when it falls. That was a very good campaign, picked up by the Honorable Prime Minister himself. And then PM launched it as Jal Shakti Abhiyan Catch the Rain campaign in 2021. And we had 47 lakh structures built all over the country with people's participation. And I have photographs of many of the structures in my website. And the water table, because of that, had gone up significantly in many places. And also we had some very interesting mapping of the water bodies in the cities as a part of the campaign. So the decentralized storage of water, which Madam was talking about, was actually done in that campaign, Catch the Rain campaign, where 4 or 5 major interventions were made. One was to create appropriate rainwater harvesting structures suitable to the climatic conditions and soil conditions. This is very important because what is suitable in Kerala may not be suitable in Ladakh. So because of soil condition as well as the climatic conditions. Because I remember Sonam Wangchuk coming and telling us a presentation of ice stupa. We had, as a mission director of the National Water Mission, I had started something called the Water Talk. I don't know, many of you would have heard that, Water Talk. Water Talk was a very popular event. Every second Friday we used to have it. This is also still continuing. And Sonam Wangchuk came and said about the ice stupas built in. But that cannot happen in Rajasthan, obviously. So it has to be climate specific as well as soil specific. So the one, as I said, was to have appropriate rainwater harvesting structures. Second was to enumerate all the water bodies. 16 lakh water bodies were enumerated. And I asked them to go for the old revenue records, map it on the ground and publish it. And in India, we have very interesting habit. No? If हमारा भला होगा problem नहीं, किसी दूसरे का भला नहीं होना. If you have a data that this area is a water body and somebody's house is there, तब से वो झगड़ा शुरू करता है कि देखो ये water body है तो water body था. Many people were not aware of it. I remember going to Ghaziabad, municipal commissioner showed me a cricket field beautiful, very good ground, which was 10 years back a big tank. And we converted that back into a tank because the people's memory also fades and the generation forgets that there was a tank there. So we could restore a lot of water bodies. So second important aspect at that Cashrin campaign was to get back the water bodies marked in the field and remove the encroachment. And the third most important was to break the water silos. Because water, all of you know, we are broken into different silos. There is an urban water, there's a rural water. There's a subsurface water, there's a surface water. And none of these people handling water talk to each other, though the water talks to each other. Water always connects, subsurface water and the groundwater, they're all connected, but our development departments do not talk to each other. Surface water does not have any idea what is the groundwater, and urban water particularly will not have any relation to the rural water. And worst of all, the department which uses the maximum, the most, 89%, 88% of water, agriculture department has no idea water where it comes from. It says it's my irrigation department has to provide water. Irrigation department provides water, and irrigation department provides so much of water that our water use efficiency is the poorest in the country. We have only 30% of water because of the use efficiency, because most of the water we waste for flood irrigation. And the water footprint is very high in India. And despite the fact that we are supplying so much of water irrigation, we have the maximum usage of groundwater in the country. You know how much water we use in the country from the groundwater? We use 250 billion cubic meters of water from the ground. And the next two countries, the China and USA, in the ranking 1, 2, 3, together do not use as much water as we use. So that is the groundwater usage. And the amount of energy we use for bringing up this water is a huge. Whether it is 25% of India's energy is actually used in pumping up the water. And that goes down and down every year. And we put more and more water pumps to pump up the water. And water is actually, as I said, affected not generally because of the policies related to water, but there are other policies which affect the water. You know, biggest threat for water comes from electricity subsidy policy, free power. If you ask what is the power connection between water and power, in most of the states, there is political parties vie to give free power to farmers. When you give free powers to the farmers, it is not the electricity which suffers, it is the water which suffers. Because most of the people put the kundi on that line and leave it open, and the water starts pumping up. And whenever the power is there available, they'll pump out water. And that's why another policy is about the MSP. Whenever you have good price for product produced, farmers go for that, whether it is suited to that area or not. So when National Water Mission, again, I had started a campaign called Sahi Fasal. Sahi Fasal is to grow appropriate crop in that area, suitable to your water conditions. You know, these are all some of the water related issues. Since I had been associated with water, I can take half a day on water supply side and half a day on the water management side. Now, coming back to the hat I presently wear, it is the National Mission Director for National Water Mission, my previous post, Director General of the National Mission for Clean Ganga, or the Namami Ganga. So let me start off by telling you a very good piece of news that National Water Mission's Namami Ganga was declared as one of the top 10 flagship eco-restoration programs of the world in 2022, December. It's a huge honor declared by the UN. The UN, UP, and the FAO at the COP24 declared from out of 200 similar projects. And it was actually declared for the three major interventions we made. One was for stopping the degradation of the environment, reversing the environment degradation, and third was people's participation. So that's one thing. And we were honored to make a presentation at the UN Water Council Water Conference in last month. And we were the only entity from India were officially invited to make a big side event. And that's where I was surprised to see the respect India has earned in the world community on the waterfront. I'm not talking about other front, but on the waterfront. We had so many countries here, and I and my minister were there, but minister could not attend many places. So I was declared as also minister. So officially, because the protocol wants the minister meet. So we were running around with more bilaterals because people wanted to know what is the story of water in India. And as Madam was telling, we have a very, very big transformation from 2014. First time, the water security, the two pillars of water security, this is the water quantity and water quality was addressed. The first one addressed was the water quality, where PM declared from the ramparts of the Red Fort that we will build toilets. So 115 million toilets have been built in the country, declared by the people, by the Gram Panchayats as open defecation free, which has increased the water quality. And there's water quantity, Catch the Rain campaign, and then a lot of other initiatives have taken up by the Prime Minister. And the most important was in 2019 when he formed the Ministry of Jal Shakti. Now, why Ministry of Jal Shakti? Water was again in silos, different people handling water and different ministries fighting with each their own decisions. So when the command came in one person, many common decisions could be taken. Still, we have problem. Urban water is different from other water, but still, to a large extent, Ministry of Jal Shakti brings in a lot of coordination from the water decisions. That is one major intervention. And when we constructed 115 million toilets, you know what we have done? We have actually reduced the world's burden of toilet-free places. SDG goal 30, everybody knows that we have to achieve the SDG in the goals related to water by 2030. And world were grappling at how we could achieve it. Sanitation was to a large extent addressed when India did that. 60% of the world target was in India, so we have achieved that. And the water connection, all of you know, the Jal Jeevan mission is going on well. So, I mean, coming back to the Namami Gange, we have got the certificate not only from the UN, but from the dolphins, poor dolphins in the water, in the river. The number of dolphins have gone from 300 to 350 to 3,000 now. It's a huge certificate for us from the dolphins. I want you to verify, because the claim we are making is twofold. One, when the dolphins number grows up and when the biodiversity is increased in the field, in the water, it is an indication that the water quality has improved. And we have cited dolphins, juvenile dolphins, which means that the dolphins are also breeding. And a second important thing is that our range of the rivers where we find the dolphins have increased. Matlab, it used to be when small stretches earlier. Now these are all found in larger stretches. Even in the tributaries, we are finding dolphins. Our otter numbers have gone up, gharial numbers have gone up. So this is a big indication that water quality has improved. And the last point indicator on us on the quality of water quality is we used to catch fish. Everybody catches fish from the river. So we introduced a system of river ranching. So in the last 2 years, I have put back 95 lakh fishes into the river. In Ganga mainstem, 95 lakh fishes have been put, the local variety. What used to happen was all the cattle fish and other fishes, which are exotic varieties, used to be there in the river. And the catch of the fishermen had a large percentage of this fish. And these fishes loved dirty water. And now the Ruwa, Katla, that's the IMC fishes, the percentage of catch has gone up. And from 4%, it has gone up to 10% now, which means that the ranching which we have done has been successful. And not only that, the fishes are happy surviving in good water, or corollary is good water loving fishes have come up. So that's an indication which should happen. And if you look at the capacity of the treatment plants, so Sundaji was telling about the speed and scope of doing it. In 2014, the biggest challenge was to get Ganga clean, which they said that it is not possible. But now people in Ganga Basin believe. I don't know, how many are you from Ganga Basin here? I hope that you will bear by when I say that the quality of water has gone up. And it is also borne by the number of people who participated in Kumbh. I'm giving you numbers because this is a testimony we get. We expected 7 crore people to attend the 2019 Kumbh. It ended up with 20 crore people. It's word of mouth. If you come to a place where it's dirty water, people go back and report that this useless water, don't go there. But if there's the water quality is good, people go back and tell, go back, the water quality is, go for taking bath. So 7.5 crores and expected crowd became 20 crores. And if you notice, this was one of the major reason why politically also it was good for the government. And water and politics are hence very, very closely connected. I know in Hyderabad also in 2008, when we gave daily water supply in 2008, after a gap of 24 years, see, the government came back. And one of the reasons CM YSR Reddy at that time openly said that one of the main reasons we came back was the daily water supply in Hyderabad. So, and daily water supply, no, I have not reached the level of Mathiavan where he says that I'm giving 100% supply, 100% the 24/7 supply, but at least daily 2 hours of supply had this much impact. Now, coming back to the capacity created, as I said, 2014, the biggest challenge was the gap 1, gap 2, and NRCD, which was supposed to clean the rivers, had not picked up well. And 2014, when the Namami Gange was launched, it was launched with much more committed budget, 40,000 crore. At that time, 20,000, another 20,000 was added later on, so 40,000 crore budget. And with an administrative and financial freedom. Probably I am the only officer in the country who can sanction projects worth 1,000 crores without going anywhere. This is a very, DG Namami Gange or NMCG is empowered to sanction projects worth 1,000 crores. I can challenge you, check up with any government officer, more than 20 crores, you have to have a committee, and then you have 200 crores, another committee, 500 crores, another committee, cabinet, all these things. But this is a very deliberate decision made by Prime Minister himself that for execution of projects, you should have freedom, you should have accountability, you should have responsibility fixed on that. And that's why we have completed almost 4,000 million liter capacity now. And again, I'll show you the picture of the completed projects. Since always talks about completion of STPs, whether it is operational, I'll come back to that also. 2014 to 2021, we completed 900 million liters. And 2022 January to now, we have completed 2,000 MLD. So in 1 year, 1.5 years, we did 2,000 MLD compared to 9 years, 900 MLD in the last 8 years, mainly because, as Matthew was telling, we have built a capacity. Last 8 years, we were building capacities. The DPRs were so poor earlier, but now the DPRs, we have built capacities to ensure that it is done properly. And we are actually ensuring people's participation. We have something called as district Ganga committee meetings, which happen every month, and they monitor and tell us the feedback from the ground on the quality of the water. So in the last 1 year, we have had more than 1,000 meetings of the district Ganga committees, which give us a feedback on that. And the two other points which we have taken up under the Namami Ganga is capacity improvement. And second, very important, is the concept of Earth Ganga. Earth Ganga is actually making a river people connect. And that's how the people's participation increased in our program. So Mati was telling about the sewage network. We have completed 4,000 kilometers of sewage network. It's very difficult to complete 10 kilometer networks, but in the last so many years, we have completed 4,000 years of network. This is some of the numbers which I'm talking about. But more than that, we have now got the people back to our program through these Earth Ganga. There are 6 verticals of Earth Ganga. One is the natural farming, because we want the non-pointed pollution source also to be controlled. We were talking about sewage which comes into the river. We are tackling it by stopping the drains and collecting and bringing to the STPs. About 183 STPs have been sanctioned at a cost of about 30,000 crore. And out of that, we have completed 2,612 MLD as of now. Another 500 MLD in Delhi will be completed. So by June, we'll be completing 3,000 milliliters per day capacity with about 4,500 kilometers of network. And that is one of the reasons where the water quality has improved. And coming to Delhi, specifically you said about Delhi. Delhi, all of you know, Yamuna, the 22 kilometers is the main cause of pollution in Delhi. And we are taking it up very seriously. And by end of this year, I would say another 1,400 million treatment capacity would be added. This is 564 MLD at Okla, then another 200 MLD at Ritala, Kondli, and Coronation Pillar. And we have every Friday meeting with the LG these days to ensure that these things are going on since LG jumped into it. So. No, agreed. I like this. I like this because I said will be completed. See that if I say it is completed today, I'll lying. So I said will be completed by December, June. We'll have it, and let that good water flow. Then the water can be clean. So please get back to me end of the next year, and you call me back here. I'll face all these people if it is not cleaned up. And second is we are also putting a lot of emphasis on decentralized sewage treatment plants. You remember the catch the rain slogan, which we started, catch the rain where it falls, when it falls. I have extended to sewage also, treat the sewage where it falls, when it falls. Not exactly, but so it is decentralized sewage treatment would be the best solution I find, because many of the policies, problems which Madam put up, conveying the sewage through cities. It's a very dirty site. And it incentivizes people to put dirt into the river. So the idea is that we should have smaller STPs of less than 1 MLD capacity in housing colonies. And I don't want water to be carried around all the place to be taken to one end of the city and then use it. So sewage management with a decentralized STP is one thing which we are focusing on. Second, this is the part of the Earth Ganga. We are looking at monetization of water and monetization of sludge. So Madam was talking about what will you do with the sludge. We have taken up with railways, with thermal power plants, with IOCL to use the treated water which we are providing, because this is going to happen now. Again, I am telling you because I told you we had only 900 MLD capacity completed in the last 1 year. But now with 2,000 MLD getting completed, we'll have 3,000 million liter capacity daily. And that brings in a lot of treated water. And that also brings in a lot of sludge. So now the point one on treated water is we have tied up with railways, Prayagraj, Agra, and Jhansi. I think Jhansi or sorry, I forgot one place. Gwalior, Jhansi. they have they are agreed with us to take this water for the cleaning of the coaches, etc., treated water. 23 NTPC thermal plants are signed with us to take this water. And we are starting with 3 now. We are already supplying water for Mathura IOCL in Mathura. About 8 mld water is being supplied already. We are supposed to give 20 mld, but we'll give it. And we are also looking at multiple use of this water for agricultural purposes also. The second is about the sludge. We are having a problem of the tremendous sludge generated in this party. So now we have taken up with many organizations like Patanjali, with IFCO, etc., to take this sludge as a soil conditioner. We have completed the trials. FCO rating is also we have got. We will be converting and selling it as brand Namami Ganga cells. So what we say is that under Namami Ganga or Ardha Ganga, with the Ardha Ganga brand, we will be selling the soil conditioner to the farmers as part of the natural farming also. So natural farming, as I said, one of the verticals, we will be using that form to FBOs which we have formed. We will be using this for that. And another important use of these sludges, we have identified many usage of sludge other than water, this soil conditioner. We are making pavements out of that. In some of the areas in Kanpur, we are trying to put back this thing. And remind of Kanpur, because I tell you, if you come to the city, I can talk about a lot of things. Kanpur, how many are from Kanpur? Anybody have been to Kanpur? Kanpur, there's a place called Shishma Nala. 140 million liters used to come every day. Is it stopped? Please. There's one proof for that. So no water drop comes out of that. And the next, by end of this June, we'll be completing all the STPs in Kanpur and the CTP, there was a central effluent treatment plant with 0 liquid discharge is also coming up. There is a chromium recovery unit, reserves recovery unit also added that. So there is a massive transformation which is happening in the use of sludge, in the use of treated water, etc. And incidentally, National Mission for Clean Ganga had come out with a framework of the treated water, safe use of treated water. And we call it not wastewater, but apna water. We call it apna water for that. And that's part of it. And so I would conclude by taking 2 or 3 points. We are pushing this 3 Rs. Everybody knows the reduce, recycle, and reuse and recycle. We have commenced studies and also worked with industries to reduce usage of water. We have 5 major industries which we have promoted. One is the paper and pulp industry. We have seen that in the last 3-4 years, the water usage has come down by 50%. We have leather tannery industry. We have thermal power plants and the textile. The water usage has come down. So the reuse of water. So in urban area, particularly when we catch the rain and store it there, actually you are actually improving the water table of that area. But there's another important aspect which we can is the reuse of multiple use of water. In all the cities, we have ROs now. The RO reverse osmosis units are there in every city now. We can't compete with Tendulkar and Hema Malini to tell that don't use that water. But then another point which Mati also said was, when we asked the Delhi Jal Board and other the water supply units, can you certify the water is good? They said, at the source we can supply it, but at the end point we don't know, because there's a lot of pipes coming, leakage coming in. So what we can use is, if we are using RO, and in fact I want to launch with her a program to stop this RO use. That's much later on, because taking on these multinationals requires somebody like you also and by me. Now, the second important thing is, in the water which reject water can be used for multiple purposes. Can you use that water for washing your vegetables? After that, can you use that water for mopping your floor? can you use that water for watering your plant? So this one water, three use. You remember the Aishwarya Rai advertisement, one use of it, she does something like this. So one water, 3 times you use it. Can we use the reducer? So, and in towns, we have a tremendous use of water for washing the car. Moradabad city municipal commissioner says that the maximum usage of water in Moradabad is for cleaning the car, vehicles. So we can use this non-potable water for so potable. We should stop using potable water for non-potable purposes and try to use multiple use of water. And the other 2 R's which we are promoting is, one is rejuvenate water, rejuvenate rivers. And the third one, and the fifth one is the respect for water. So we actually are working for improving the respect for water so that water is not misused. So one more point I would say, Namami Gange, we have started something called as a River City Alliance. This is a alliance of the cities on the river banks. It's an energy unit. Not all cities are blessed with rivers. And most of the cities blessed with rivers are using this river as a conduit for putting their dirt. In our foreign countries, these rivers are used as a area for recreation, for increasing the riverfront value, etc. But we are now trying to give up, trying to inculcate that feeling of pride of the rivers with who are cities. In the alliance, we have 110 cities joined to exchange knowledge and exchange information, and also to use river as one of the biggest tools for urban planning. Urban planning talks about only flyovers, traffic management, and then parks, etc. But no water management, urban planning talks about water management. So we are trying to get that the River City Alliance. So I'll leave these books with you if anybody is interested. We came out with the Pune declaration because the last meeting we had in Pune had a declaration where the municipal commissioner, these 110 municipal commissioners have promised to catch the rain, to ensure that the rivers are clean, and then they will do a planning of it. And so these are some of the points I would like to say. And the last point I would like to say is we were looking at the monitoring part of it. We have started something for a real-time monitoring in Namami Gange. Day first today, Minister has inaugurated Prayag. Prayag is platform for real-time monitoring of Yamuna and Ganga. We have real-time monitoring from 175 STPs, which uses the water inflow in STPs. What is the quality of inflow? What is the quantity of outflow? And what is the quality of the outflow? We were telling whether the STPs are working or not. I can see it at my office where all the 175 STPs outcomes, the outputs are monitored and known. So monitoring is ensured by this technical tool. Monitoring is ensured by the district Ganga committee meeting, which happens every month. As I said, 1,000 meetings have happened. Monitoring is ensured by the people who go to the river to take bath. Monitoring is ensured by the feedback we get from various political sources, because now if you notice, no political parties now talk about poor Ganga water. I mean, at least if you have noticed that Yamuna water, yes, but not about the mainstream Ganga. So I leave it at here. So we have a tremendous opportunities to work up. We will be working on the decentralized STPs, which will make a major difference in this country. And let me tell you, another 2 years, most of the river in Ganga and the tributaries, most of the areas would be clean. And we are learning that experience. We are trying to transform it to the other cities, so which is the other hat I wear. I am also the PD of the NRCD. So we are trying to put it in other cities also. Thanks a lot for patient hearing. I know it was a very long one.
Thank you. Thank you. I think what is really remarkable is the infectious enthusiasm and commitment you have heard from both. Normally, when we have government officials on this side, we are the ones who are doing this, and they are the ones who are basically saying, there's a program, there is money, we are spending it, and a lot is happening. But I think what you have heard today is two very unique individuals, and I'd really like to thank both of you for coming, and for sharing both your work, but from our perspective, also your very deep commitment. Your deep commitment to the issue of inclusivity, your deep commitment to the issue of sustainability, and of course, your incredible work to make this happen on the ground. So I would like to thank both of you from all of us. Thank you so much. And Ravi, I think it's for you to give it to both of them. Okay, come. You are very poor. No wonder they don't give you a picture.
This must be both in content as well as, so this is a book which we made with Mika. This book is actually about wellness work. Wellness wise, there's a lot of emotional connect with wellness. And this is about all the districts in the ministry. And every aspect, including culinary, dancers, arts, big persons like Amitabh Bachchan coming from Allahabad, all the names in that. Where Draupadi, Ramana, Mahabharata, Bonadil, everything of the districts and the nation of here. Because Kenya is unique.
People will go on. Thank you. Really, I will not share this book with them.
Thank you.
So, what I'm suggesting now is electricity. I think after there is stimulating partnership, be together. You come back here. This place, the advantage of this place is you can't go in. Okay? So, friends can go in. Take them in the there with us. PSC style in TV and in the time. So, this process is going to, I think, normally it's fair and I would have one thing to prepare. So I think what we see the need and all conversations. I think I will spend a little time listening, and I'm not going to get over to that. So break the tea, we come back here at about 12, 30, 35. There's a group code. There's a group code. Break the next session.
Yeah. We request everyone to collect at the amphitheater in the open space for a group picture after your tea. So, yeah, after tea, just before come. Yeah, please, can we collect at the amphitheater now? And we'll take the picture and come back for the tea. Yeah. Amphitheater, please.